Hi, my name is Dr. Hayes Arnold. I'm with Gastroenterology Consultants of San Antonio here at our Tupperwine office. I know that a lot of you are out there suffering with GI issues, reflux, bloating, changing your bowel habits, abdominal pain. Just want to let you know we're here right here on Tupperwine Road, and we'd love to help you with your problems. Just come on by or give us a call. Back to Florida, went to medical school at University of South Florida in Tampa. I also got a master's degree while I was there in zoology, and then the Army decided to call me back to pay them back for the time I owed them for the Princeton scholarship, and they brought me out here to BAMC, where I did my training in internal medicine, and then did a chief of residence year in internal medicine and 3 years of fellowship at BAMC. So I'm a general gastroenterologist, which again means I do the basic GI work, mouth to anus, and then have a little extra additional interest in liver disease and do quite a bit of that. I do endoscopy and colonoscopy. Upper endoscopy, obviously looking in the esophagus and stomach, and colonoscopy is a bulk of our endoscopic work that's looking obviously at the colon and trying to prevent colon cancer. I do some, again, additional liver work, and that focuses a lot on fatty liver right now, which is a major health issue, particularly here in South Texas. We see a lot of reflux. That's a common issue. We do see a lot of bowel habit issues. Constipation is a common problem, particularly among our female patients. We do see, of course, diarrhea, irritable bowel syndrome is another common complaint. Rectal bleeding, you name it, bloating, gas, we see it all. This is one-stop shopping, so all our office visits are done here, and all our procedures are then done here. There are some procedures which, for either safety reasons or because of specialized equipment, may need to be done either at a hospital or one of our other locations. But in general, most of our GI work is done right here. And so I think it's a personal relationship, it's a long-term relationship. Even for a gastroenterologist as a specialist, I still like to maintain contact with my patients and kind of get to know them. I think it really helps build a stronger alliance and helps me know the best way to treat them. Everybody's a little different. They all have different desires or goals in their treatment. I think it's stay active. It's all the basic stuff that we hear on the news every night. Stay active, avoid the overeating, and everything in moderation. Enjoy yourself, but don't enjoy yourself too much. It's really simple. I mean, there's an acronym in the Army, it's called KISS, Keep It Simple, Stupid. And I think we overthink things. We got lots of fancy diets, lots of fancy exercise programs, and really we just need to do the basics. And that's, again, avoid the overeating and keep moving. Oh my goodness. In GI, I mean, we are so, it's a procedurally based specialty, so gosh, we have so many different pieces of equipment. Our scopes, when I started in training, which wasn't that long ago, our scopes were much more cumbersome, they were much thicker, a little more unwieldy. It's just, my gosh, we've got specialty cameras that can balloons snake their way down deep into the small intestine 10 and 15 feet, where 15 years ago we would have had to take those patients to the operating room, had a surgeon open the patient's belly, and then we would have passed the scope using their hand through the patient's intestine. It's just phenomenal to me. So when we do have patients show up, they should feel comfortable knowing that they will have access to some of the finest equipment and some equipment that's only available here at GCSA. Some of our liver research equipment we have available that no other practice has in San Antonio or South Texas. We've got additional equipment available to perform endoscopic ultrasound that's done right here in the office. We have breath testing to look at a variety of different conditions that are not available at most other gastroenterology offices. We have wireless capsule endoscopy, which is also done in the office. So we have the equipment and the most up-to-date equipment to handle any gastroenterology need.